Good day, this is Dr. Rob Troell. I get frequent questions from patients is, who's qualified to do my facial rejuvenation procedures? Anywhere from neuromodulators to fillers, laser skin resurfacing, to facelifts, eyelid surgery, brow lifts, or implant surgery. So if we look at who's qualified, there's a variety of different disciplines that are trained during the residency and fellowship. However, all of them have limited training during those trainings. So why do I work for Implant Tech Associates, the largest implant company in the world, and do courses? Why? Because it's needed. People don't get a lot of experience, so we have a cadaver course with didactic talks that doctors can come in on a cadaver. We teach them to put all these implants in. So the advantage of myself, I'm a facial plastic surgeon and cosmetic surgeon that trains other surgeons that do plastic and cosmetic surgery to do these procedures. So I'm considered by my peers as an expert in the field. So oral maxillofacial surgeons, ophthalmologists, cosmetic surgeons, facial plastic surgeons, otolaryngologists, plastic surgeons. They're all trained how to do facial rejuvenation in the face. It's good to have that training, but to move over to doing implants is a different type of training that you need. So if you're going to go to a physician, ask what their underlying training is specifically for facial implants. The advantage of facial implants is far superior than temporary fillers because they're permanent. It's better than Bellafill because it's more cost effective. If you put an implant in certain areas, constricted envelopes, they can push them out. The mid-face can give you a facelift at the same time you put the implant in, so you don't have to pay extra for the facelift. If you're getting a deficiency of your chin, putting an implant there is the best technique than using fillers or fat to get a good contour to your jaw. Also, we can combine these. Often I combine facial implants, facelift surgery, other volume replacements such as Bellafill, as well as using fat transfer. In some patients, I do all three at the same time. I'll put an implant in the mid-face that lifts their face. They have pan volume loss, I'll put fat everywhere, and then I might put Bellafill in the tear trough area. So using combination therapy is going to yield the best aesthetic results. So being an expert and a trainer in facial implant surgery, you should ask the patients that you know, or physicians that you're going for a consultation for facial rejuvenation, what their training is. So make sure you make the right choice of who's actually adequately trained for the implant that you want to optimize your overall aesthetic appearance. So if you like, you can make a consult to my office. We do full facial analysis and facial rejuvenation using implants, fat, and fillers.